Hello and welcome to yet another great podcast here at CGI. We have a great legend in the DBH field here, Dr. Christine Morninghoff. And Christine, can you share your journey and experience as a DBH who became a licensed psychologist and what led you to focus on the link between mental health disorders and chronic medical conditions?
Sure, I'm happy to, Grant, and thank you so much for having me. This is such an honor. My journey actually started, gosh, I'm dating myself here, but back in the 90s,
Hmm.
when I finished my bachelor's degree in psychology and my master's degree in clinical psychology. I
Hmm.
decided I kind of needed a break. So I,
Okay.
stopped school at that time and I became employed at a local hospital in New Jersey
Hmm.
as a school-based counselor. And at
Okay.
that time, I wasn't seeing anybody medical. It was mostly everybody was in school. Then an opportunity came up where I could become a mental health professional in the emergency room as an on-call psychiatric on-call worker was basically what they called it. And
Hmm.
that was kind of my first taste of working in a medical setting and providing care. The thing is, it was very it really wasn't integrated care at the time because when I was called, it was for people that were coming in for psychiatric emergencies. It wasn't for medical per se. However, just being in that setting,
Hmm.
seeing all of the medical stuff going on, and also being privy to all the mental health folks that were coming in. It was just a really neat environment. It was very fast paced. I really liked it. I didn't love that it
Hmm.
was in the middle of the night. I loved it.
Ah,
Yeah, that part was
there's
a
a
little rough.
difference. Right.
Yeah, exactly. But I did like the environment as far as it being, fast paced. So fast forward to that, I took a little time off to have my kids, and then I eventually moved to Nevada. And then I decided I started working as a mental health counselor at first for the state of Nevada. And then, eventually I kind of realized after working in the children's psychiatric hospital,
Hmm.
I realized I wanted to go back and pursue my education a little bit further.
Okay.
So I looked at many different programs, looked at the DBH program, and at the
Hmm.
time, it was all of the professors were licensed psychologists. So it was sort of a natural progression for me, having
Hmm.
come from a psychology background. I
Hmm.
said, yeah, this might be the program for me. So I was in the first cohort, kind of got in there, got really good experience, good education there, and after I left, I pursued a licensure as a psychologist in Nevada, which was a
Mm.
bit of a journey because, as you know, it's sort of not a straight path, as
Right.
other psychologists take, but it did work out. I was able to get licensed as a psychologist. And ever since then, I'm still working for the state of Nevada. As far as medical settings, I was able to work in a psychiatric hospital, which
Hmm.
had medical and, so people come in with all different kinds of things, but it's mostly psychiatric, but they have some co-occurring medical conditions as well. So just being exposed to all of that, I also worked in the
Hmm.
prison system for 5 years. There was a lot of
Oh.
medical conditions in the prison system for people that also had co-occurring mental health issues.
Hmm.
So all in all, there was a lot of exposure, and I just was always really interested in that intersection between what's happening with the body and what's happening with the mind. I don't really separate the two. A lot of people do.
Right.
I kind of don't. So
Absolutely.
yeah.
Absolutely. Can you provide us examples of case studies that illustrate the intricate relationship between the two?
Sure. Say, for example, if someone's diagnosed with type 2 diabetes at the age of
Hmm.
35, the potential exists for that person to develop anxiety regarding their condition or even
Right.
depression, about having to constantly watch their diet or constantly test themselves, testing their levels, multiple times a day. That can be a bit of a downer, it can be kind of depressing. Another example would be if someone has major depressive disorder and then that person's, self-neglect patterns undermine their self-care behaviors. So they
Hmm.
may not go to the doctor's appointments when they are
Hmm.
scheduled to go to the doctor's appointments or just avoid doctor's offices altogether. They may not, um, they just might not be treated properly because their mental illness symptoms keep them from getting that proper care or from
Hmm.
engaging in self-care techniques that we know work, right? Like good diet, good
Hmm.
exercise, good sleep, hydration, the whole nine yards. So I think that's just two examples of how a medical condition can affect mental health and how mental health can affect a medical condition. So goes
Absolutely.
both ways.
Thank you. Thank you. Thank you. The Biodyne model training.
Yes, the best training ever.
Hey, absolutely. And some consider me like a master in it, but you were the master before, the blaze the path for me to follow. So,
Mhm,
respectfully, I'm asking, what is the Biodyne model, and
mhm.
why is it crucial for master level clinicians to be trained in this approach?
Okay, so the Biodyne model provides focused intermittent psychotherapy when
Hmm.
the individual needs it,
Right.
not just whenever, but when they need it.
Hmm.
It's developmental in nature, and it examines how emotional distress affects physical symptoms. And the model also focuses on stressful disruptions in life at different stages and life events.
Hmm.
So the reason why it's important for master's level folks to be, trained in it is because there are a lot of master's level clinicians out there. From a workforce recruitment standpoint, there's a lot of master's level, folks out there, which is wonderful. It's great. We need as many clinicians, well-trained clinicians and interventionists as we can possibly find. Please send some to Nevada because we're short here in Nevada. But it's
Okay. Job opportunities, marketplace there.
that's right. That's right.
Right.
But it is really important because these are folks that can go into these settings and provide a very needed service. I think it's just really, really important that we get more people out there in this field.
Hmm. Hmm. How does the Biodyne model differ from other therapeutic models, especially when addressing the link between mental health and chronic medical conditions?
So the one thing that I don't see with other models is that they don't focus on chronic medical conditions at all, really. I think the
Okay.
Biodyne model is unique in that way. Other models, while very useful in their approach to addressing mental health issues, do not focus the
Mm,
combination between mental and emotional distress and how that impacts a person's chronic health condition.
mhm,
So I think that the other models can be utilized. This is one thing I've always loved about the Biodyne model. The
mhm,
Biodyne model never said, don't use CBT, don't use DBT, don't use this or that, ACT or, you name it. There's a whole laundry list of models, right? The Biodyne model never says, don't use any of those. What it says is kind of start with where we're at, use our model and integrate. You can utilize aspects of really any model at that point. You can use CBT approaches, you could use DBT interventions, you could use all kinds of interventions within the Biodyne model, which I really like because that makes it so flexible and so,
very.
it's
Mhm,
not this, they don't put you in a box. The Biodyne model I never felt like I was being put in a box.
me
So
either. Hmm.
yeah, I really liked that approach. I like that it was, efficient and quick, not long and drawn out unnecessarily so, where some other models can be a little bit long and drawn out, like psychoanalytic or psychodynamic, some of those approaches can be long, years and years and years. But I like the Biodyne model because it was focused, it was quick, it was get in there, figure out what's going on, and get going. So I really like that.
Correct, correct, correct. Can you discuss the benefits and challenges of integrating mental health services into the broader medical care context?
Well, I think the benefits are numerous. In terms of
Hmm.
working on a treatment team, the physicians and the other medical professionals now have a partner on the mental behavioral health side.
Right.
As far as the patients are concerned, they have a mental health professional to help them address their mental health concerns related to their medical diagnosis.
Mhm.
So I think that's really important that the patient has an advocate, someone else who can talk with them and discuss their issues, and the medical folks can do their thing, which obviously that's super important too. That's why they're there. But I think it's good to have everybody on board. As far as challenges, I could tell you one challenge that I recently encountered,
Mhm.
which this literally just happened about 3 days ago. So this is like super recent on my mind. It's top of my mind. A few months ago, I was approached by a company out of Houston,
Okay.
integrated healthcare company. They were looking to expand their services to Nevada, and there are at least two hospitals near my house that I would have been able to provide services in, and I would see about four patients in an hour, and get a certain percentage of whatever they got from the insurance company. Okay, that sounds great. My background was perfect for it, having gone to the DBH program, et cetera. And being a licensed psychologist, that was exactly what they were looking for. So they sent me an offer letter. Everything was great until I went to get credentialed by the hospital.
Hmm.
And the hospital declined my credentialing because they said I didn't go to an APA accredited program, and therefore I was no longer eligible to be credentialed. And I thought, gosh, isn't that a shame? I've been a licensed psychologist for 10 years. I have the DBH degree, which is clearly a perfect fit for being in a hospital setting and dealing with folks that are going through rehab and all kinds of medical issues. It would have been a really perfect fit. And just a few days ago, they said, nope, you're not eligible. I was like, gosh, it's a bit of an odd barrier. And it's an unfortunate barrier. So I can imagine that, across the country, there's just these challenges of getting in to these settings in a seamless way. I feel like, what difference does it make if you went to an APA accredited program? If you have a license, if you have the credentials, you should be able to get credentialed in their system. But yeah, it didn't work out. So,
Right.
I mean,
Because if the state says you're qualified and you passed all clinical exams, okay.
yeah. And meanwhile, I've been licensed for 10 years with not any issues whatsoever. So I don't understand what the issue is, but that's their issue. And that's something I think, and that's a barrier, that's a challenge. And I think that's something that if the hospital settings look at, are we getting qualified people to come in and do this work? Are we getting folks to come in that have adequate, training in these interventions and stuff? If
Mhm.
they realize that they're not, they're going to have to open up I mean, at some point, someone's going to have to make a decision that they should open up their, the pool, of applicants,
Yeah. Because
So
some of their approaches is blocking access to care, period.
absolutely, they are
Uh,
blocking access. Yes, 100%. So now they don't have me to go in, which I'm not saying I'm the only other person that could have done. So there's plenty of people that can do it, but I do have that skill set that a lot of other people don't have, and they're kind of missing out. So it's kind of a shame for them and for the patients, but that is a barrier. That's a challenge. So somehow we have to figure out how to help people understand that an APA accredited program, while very valuable, I don't discount the value of going to a program that's APA accredited. That's wonderful, but
mhm.
it's not the only avenue to being able to provide quality interventions and quality treatment. So
It is not.
it's not. Now there are
It
others
is
of us out
not.
there that are pretty well qualified to do this stuff. So anyway.
Absolutely. Okay, thank you. 'Cause that's a great personal story right there.
Mhm.
Um, so how does the Biodyne model align and support the principles of like the value-based care model?
So, with a focus on population-based health, healthcare leaders trained in the Biodyne model can transform
Mhm,
systems in a way that hones in on prevention, higher quality and lower cost care, and chronic care management.
mhm,
The Biodyne model is perfectly aligned as it covers medical and mental health. It covers it's got a larger umbrella, a larger tent, if you will. So I think it aligns really well with the value-based care model because that's a model that wants to provide lower cost and higher quality care, kind of like all in one, right? So getting people all to be there is, mental health folks. I actually believe other folks should be under that tent too, nutritionists and all kinds of folks, rehab folks, PT, OT, kind of like whatever's necessary, get everybody under that tent so that folks can get the care they need, not just in one area, but all areas.
mhm. Okay, great. In what ways can an integrated approach to mental health and chronic medical conditions enhance the overall value of patient care from your perspective?
I think the most important step would be to have a Biodyne model trained mental health
Mhm,
professional embedded in all medical settings, from
mhm,
primary care to ERs, rehab centers, nursing homes, community health centers, you name it. Again, I reiterate this. I also believe a nutritionist should be a part of every location as well, because medical schools do not spend a lot of time training, you know, physicians to be about how nutrition impacts a person's whole health. And I think that's an area that's seriously lacking as well. So I think this kind of co-location of professionals creates a one-stop shop approach and with time limitations that everybody has, right? You don't want to have to go to 5 different locations to get your needs met. Why not just go to one and get all of your needs met in one location? So
great.
I think
In
that would
one
help.
location right there.
I would love that. That would be amazing. Instead of
Absolutely.
referred out to 5 different people, which is crazy. Who's got time for that?
Good deal. Good deal. Moving along, how do you measure success when using the Biodyne model in context of mental health and chronic medical conditions?
So Grant, I think there's two ways. I think,
Mhm.
first and foremost for me, I would really just rely on the patient to inform the level of success, right? So if they're feeling better on the mental health side and on the medical side, then I'll know, right? To say, "Oh, I'm feeling better. I'm doing really well." That's great. Obviously, you could also use brief standardized assessments to measures to ensure that data can be collected. So, we do live in kind of a data centric world right now where
Absolutely.
folks want to see data outcomes, not just these qualitative, vignettes of, oh, my patient says they feel better, so therefore they're better. I mean,
Mhm.
that's one way. It's one way to look at it, but the other way is using, brief standardized measures, sort of like pre and post. How were
Mhm.
they when they came in? How were they when they left? And
Mhm.
then maybe ongoing. Touch base with them in 3 months, 6 months, a year. How are you still doing? Are you still doing okay? Using these brief standardized measures, nothing too cumbersome because nobody wants to be bogged down with a big cumbersome tool, but those standardized measures are helpful and they're reliable. So I would definitely not hesitate to use them to measure some success. I also think the other way you can do it is looking at some of these data dashboards that the
Mhm.
states and the counties and the cities have, where they look at more population-based health outcome measures, like the health district. I don't know about everybody who's watching, but in Nevada, they have, the Nevada Health District, and they have, a data dashboard that you could look up at any time. How is
Okay.
everybody doing by way of, obesity measures, smoking,
Mhm.
um,
Mhm.
COPD, diabetes, some of these bigger population health, even things like poverty, things like they look at those things, nourishment for kids and things like that. You can look at those year over year and see if there's things are going up or down, and that's one way to look at it as well. So that's more of a macro view, but from
Mhm.
a micro view, really just individual patient basis, just asking them how
Mhm.
they're doing and
Mhm.
also looking at their lab results. I mean, hey, if they've got a certain issue that labs will tell you the story, look at their
Mhm.
labs, right? How are they doing there? Yeah, there's just so many different ways, but those are just some examples.
Right, right. Thank you for those examples. Here at CGI, we are the only designated DBH program focused with the Biodyne model, period. I
Right.
often call us the brainchild of all DBH programs in the
Yes.
institution.
Yes.
That's
100,
just
100%.
facts, facts,
Yes, it is
facts.
100%.
So, how can healthcare institutions and academic programs support the Biodyne training?
Well, I think first they have to know about it.
Hmm.
And once they know about it and they realize the positive impact that it will have on the clinicians and the interventionists of the future, I think adopting it is sort of a no-brainer, right? You kind of realize once you learn it, it's
Hmm.
it's it's applicable. It's very user friendly. It's very applicable to all settings. I've never encountered a situation where I couldn't use the Biodyne model. And
Hmm.
like I said, I've been doing this work for as a licensed psychologist for 10 years, but many years before that in a master's level capacity,
Hmm.
right? So
Hmm.
I've been in
Hmm.
this industry now for coming up on 30 years. So I've really never, and I didn't learn the model until, let's see, when did I finish? I think I started in 2009 and I
Okay.
finished in 2012. So it's been a
Okay.
bit, right? And I've never, ever since I learned the model, I've never encountered a situation where I couldn't use it. I've always been able to use it.
Same here.
So
Hmm.
I think if other programs know about it, they can appreciate it and see how it's very user friendly and it works. It really works on
Hmm.
helping people throughout their life cycle intermittently. It's efficient. Nowadays with well, it's not even, I would say nowadays it's for many 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 days
Hmm.
going back. Cost
Hmm.
cost containment is always an issue, right? So I think the
Hmm.
Biodyne model fits in really well with, I guess, the value-based
Hmm.
care is probably a better way to say
Absolutely.
it. As a cost containment, but it's really value-based. They want high quality care, but they don't want to spend a gazillion dollars on it, right? So I think
Right.
this model fits in really, really well. So if
Hmm.
with that model, right? So I think if they could just know about it and look at it and learn it themselves, they can
Hmm.
see how important it is to teach it to other people. So I don't know any other way to do it, but I think that's a one way to do it.
Especially when it's a proven evidence-based model.
Absolutely,
With
100%. Why
the
not why not want to use something
why
evidence-based?
not?
Everybody's talking about evidence-based in our
Right.
industries.
Correct. Correct. Another great opportunity I heard was open to you as a door to providing other services in other areas. Can you please enlighten us of those opportunities?
Sure. I was recently made aware, it was probably in the summer or fall. It was in the fall of 2023. I was made aware that New Hampshire had just passed a law that made it much easier for a licensed psychologist from one state to be licensed in their state. And they pretty much streamlined the process with just a one-page application, as like a 1 or 1.5 page application, and an application fee, of course. So I went ahead and I applied for reciprocity, basically between Nevada and New Hampshire, and I became a licensed psychologist in New Hampshire about a month later. So they weren't kidding. The process was seamless and it was easy, and so now I'm licensed in New Hampshire and Nevada. So
Still blazing the path to DBH, licensed psychologist, licensed in Nevada and in the state of New Hampshire. I got to give a salute to New Hampshire for being innovative and for opening the doors and increasing access to care is much needed. And when you have licensed, approved, educated folk that are there and willing to do the work with the experience and with the, just the supportive background, open the door. Open the door is just that simple. That simple.
absolutely.
So
Kudos to them.
absolutely. So thank you for sharing that with us. As we look into the future of integrated care, what do you see as far as the future of integrated care heading, particularly in terms of addressing the connection between mental health and chronic medical conditions?
You know, I'm not I'm not 100% sure where I see it going, because I'm not on a daily basis, I'm not involved in that world. I know a bit about it from other perspectives, but I'm not embedded in it all the time.
Hmm.
I I wish I could say that we were closer to being exactly where we needed to be. I wish I could say
Hmm.
that, but I mean, even when I go to get my own medical care, there's not a lot of integration at the level
No.
of when I go to get my own medical care, like for
Hmm.
checkups and
Hmm.
such. There's not a lot of
Hmm.
conversation about,
Hmm.
well, how is your mental health, And I'm not saying anything negative about my medical providers. They're great. I love my medical
Hmm.
providers,
Absolutely.
but they really don't, and it's just something they just don't really focus on. But if they
Hmm.
had someone else there who could also sit with you and ask you, how are you doing? How is your mental health? Are
Hmm.
you
Hmm.
feeling okay? Are you sleeping good? Are you feeling like you're getting adequate exercise and a good diet and all that fun stuff? Feeling anxious, depressed, whatever, like how are you doing? But those
Hmm.
those aren't really, even today, right? It's 2024 already. Like, and that people don't really focus in on that at all. And it's kind of unfortunate. I wish I could even see it just in my own, even though I'm not in that field specifically right now, where
Hmm.
I'm in integrated care, because I'm not, but I wish even in my own medical setting, I wish where I was getting medical care, I wish that was more apparent, but it's not. And
Hmm.
I don't know what it's going to take. I don't know if it's just a slow progression. I will say this, I was actually super enthused. And even though it ended up not working out for me, I'm super enthused about the fact that this company from Houston's coming into Nevada to do this integrated care in the hospitals.
Hmm.
I may not ultimately end up being a part of it because of these challenges and obstacles that we talked about before,
Hmm.
but I'm very encouraged that it's happening nonetheless. And I know one of my colleagues down the hall, in my private practice right now, one of my colleagues is actually going to be doing that full time. And she did go to an APA accredited program. She's a licensed psychologist, so she's no problems there for her. She'll be able to get in, no problem. She's going to be doing that full time. So I'm really encouraged to know that that's happening locally for me, and that's going to be in
Hmm.
two hospitals really close to my house and one hospital down in Henderson, which is about 30 to 45 minutes south of me. So in the valley, we're going to have at least 3 hospitals that have an integrated healthcare provider. So that's kind of neat. I'm
Okay.
happy to see that. I hope that continues. I hope I see more of it, and I would love to see more and more and more integrated care. I feel like in a way it's kind of slow going, but I think we're getting there. I think we're making some inroads. So
Okay.
all change takes time, it's just the way it is.
Hmm. Thank you for that insight as we look into the future.
Sure.
Again, I would like to say thank you. Thank you. Thank you for taking the time out of your busy schedule to join us today. The legend.
You are
Dr.
so
Christine,
funny.
man, I mean, I'm being honest with you. You blazed a path that many of us are watching. Um,
Oh, thank
Coming
you. I
into the
appreciate
program
that.
of we were looking like, oh, this is interesting, Oh, she became a licensed psychologist, as DBH. Just, you blazed a path that drew many. many people by the droves into the DBH field. So your name is right there stamped into the halls there. So I have to,
Thank you
give
very
credit
much.
where credit is due.
Thank you.
And
That's
I'm
very
quite
kind.
sure. Mhm. Yeah, I'm quite sure Dr. Nick Cummings is proud of all of us carrying on the work.
Oh, no doubt. This was his baby, to see
Mhm.
people forge a path with this degree. And it really is all because of him that and not just him, but him and Janet and the whole crew, like everybody gets credit. Like
Mhm.
for being so supportive and being so helpful along the way. I can't even tell you how much support they gave me along the way. Just so many different times that I reached out and they were always just immediately willing to help. So,
Mhm.
it was just a great experience all the way around. I have nothing but great things and great memories from that program. So it was wonderful.
Wonderful. And with Nick and Janet and Blaze Path for you, look at all the other opportunities and careers that have been
Mhm.
established. So
I
thank
agree.
you. Thank you
Thank
for being a
you.
part of that. Thank you for
You're
being a
welcome.
part of
And
that.
thank you so much for talking with me today about such a great topic. It's so near and dear, and I love to talk about it. So thank you.
Absolutely. And to our audience, we thank you for coming to yet another great podcast. We encourage you to like, share, and subscribe to our podcast. Have a great day.